Good day to everyone. It's a pleasure for me to be here and to be able to share with you some ideas that will allow you to understand the abortion situation in Latin America and how we, from the National Societies of Gynecology and Obstetrics, are promoting safe abortion in our region. You can see here that more or less 56 millions of abortions take place each year worldwide, and estimate that 25 millions are unsafe. These represent the 45%. In Latin America, occur 6.5 millions of abortions by year, 40.5 millions are unsafe, and this represent that the unsafe are the 76%. This situation represents for us a serious public health problem due to the high contribution of abortion to maternal death in Latin America. You can see in this WHO publication that the abortion is the major cause of direct maternal deaths, behind hypertension and hemorrhage. For this reason, 18 years ago, FIGO promoted the FIGO initiative for the prevention of unsafe abortion during the presidency of Dorothy Chow. Most Latin American countries, under the leadership of Dr. Aníbal Faúndez and Luis Tábara, in one way or another, made the problem visible and provide actions to prevent it. In 2018, FIGO established the Safe Abortion Committee, chaired by Dr. Jaideep Tang, as a strategy to improve women's health and rights and reduce disparities in abortion care. Between 2019 and 2022, the FIGO Safe Abortion Advocacy Project was implemented in selected countries in Africa and in Latin America, and from Latin America participate in this project Peru and Panama. Now, FIGO is working in terms to promote the total decriminalization of safe abortion. This implies that the police and the legal system are not involved in the investigation or prosecution of safe abortions. Instead, abortion care is treated like any other essential health issue in medicine, for which the standard of care is based on the best practice guidelines, training, and delivery. Today, this is the access to abortion in Latin America. It is totally prohibited in these four countries: Honduras, El Salvador, Nicaragua, and Dominican Republic. It's permitted by law in case of maternal health, rape, and fetal malformation in most countries, and only a minority has made progress toward the decriminalization. Cuba, Uruguay, Argentina, Colombia, Guyana, and partial in Mexico. Legislative, regulatory, and access to health service and knowledge and misinformation barriers still persist. The lack of scientific and evidence-based concepts, the lack of protocols and restricted interpretation of that, the lack of root implementation and quality of the service, and the misinformation not only of the health providers, also of the community. This implies that the no recognition of women's self-determination. Now, there is a new scenario that is even more critical in our continent. Although in most countries it is legal for health reasons, rape and fetal malformation, the access is limited. In general, in our continent, is a privilege only for some with greater opportunities, resources, or the fortune of having a provider willing to comply with the law. And it's correct to say that in Latin America, in most countries, it is illegal, although it is a privilege of a few. The scenario today is very complicated because before the COVID-19 pandemic, women's access to voluntary termination of pregnancy worsened. Remember what happened in the USA after the overturning of the Roe versus Wade ruling meant a 50-year setback by leaving the decision of whether abortion is legal or not in the hands of each state. Additionally, due to the economic dependence of the USA, many governments in the region, by pressure of Mr. Trump, are reviewing their legislation regarding abortion. Only in exceptional cases do national gynecological societies play an advocacy role for the right to abortion. In this terrible scenario, our Latin American societies of obstetrics and gynecology propose this strategy to raise awareness and engage the leaders of the 19 member societies to advocate strongly for the protection of sexual and reproductive rights in general, including the right to abortion, taking into account that in several countries it is still considered illegal. FLASOG invited representatives from the 19 affiliated societies and international cooperation agencies to participate in a workshop who at the end of it prepared the Panama Declaration. This workshop was made in Panama in the framework of the second summit of women's rights and anti-conception. And this declaration, and this Panama Declaration highlights the commitment to promote training in clarification of values in sexual rights and reproductive rights. In this declaration, FLASOG ratifies its commitment to the protection of the right to a satisfactory sexual life, free of violence, and the risk of acquiring disease or unwanted pregnancy, the right to motherhood without unnecessary risk of illness or death, the right to freely decide on their fertility, and the right to the interruption of pregnancy in cases permitted by the legislation in each country. And in this declaration, the commitments of the affiliate societies was this. First, that each society and federation of gynecology and obstetric establish or strengthen the committees of sexual and reproductive rights. That each society and federation of gynecology and obstetrics promote the inclusion of young colleagues to provide continuity, follow up, and ensure compliance with the recommendations. Also, promote the participation of professors, heads of gynecology and obstetric service, directors of maternity hospital, or colleagues that are in executive positions in public or private organizations. The commitment to include these contents in the curricula that responds to the needs of women for the free exercise of their sexual and reproductive rights. Additionally, the commitment to include in the activities of continuing education topics related to the sexual and reproductive rights of women, ensure that together with the governmental health authorities, draft and implement norms that define the procedures, ensure the existence of technical service and supplies in the public sector, that allow the protection and promotion of sexual and reproductive rights. The commitment to establish alliance with public and private institutions from national or international organizations in order to enhance the effect of the actions, and finally serve as source of information for the mass media for the dissemination of scientifically correct information regarding the sexual and reproductive rights of the woman. In alliance with FIGO and non-governmental organizations, and based on the Panama Declaration and the Cartagena Declaration, FLASOC developed an initiative oriented to values clarification in sexual and reproductive health in Latin America, with emphasis on vulnerable countries. This initiative has as general objective strengthen the leaders of the 19 societies affiliated to FLASOC to achieve a greater commitment in the defense of all women's sexual and reproductive rights as an inseparable part of human rights. The specific objectives include generate behavioral change in our colleagues, create or strengthen the committees of sexual and reproductive rights, select young leaders to be training and facilitate the continuity of the project, foster alliance with collaborators to amplify actions, and integrate actions advocating for sexual and reproductive rights into the public agenda. The project involved 18 of the 19 societies that are part of FLASOC, and each society select 2 colleagues per national society who participate in training workshops and became the development of a cascade intervention aimed to drive behavioral changes in these colleagues and other healthcare workers through value clarifications in sexual and reproductive rights. The workshop aimed challenge assumptions, clarify values, transform beliefs, and state intentions. During the period, the national societies held 44 workshops in which more than 1,000 of health professionals participate, mostly OB/GYNs, physicians, and trainees. The participants comment that the workshop was interactive and dynamic, and made them question their beliefs and values on such a crucial topic that is closely related to our day-to-day lives, such as sexuality, access to sexual education, and abortion. The project allows the visibility of in the different social networks. Additionally, other important achievements was the support to the government of Honduras for the approval of emergency contraception, amicus curiae for the voluntary interruption of pregnancy in specific cases in Guatemala, El Salvador, and Peru, ratification of therapeutic abortion and emergency contraception in public hospitals by the Supreme Court of Justice in Peru, ratification of the sentence of the Constitutional Court of Colombia about the decriminalization of the voluntary interruption of pregnancy during the first 24 weeks of gestation. This slide shows how there was a great visibility in the different social networks. The project also allow to obtain money. FIGO put the seeds money, $40,000, but other donors put a very important amount of money, included the national societies. And you can see the very important amount of money that we mobilize in this initiative. The sexual and reproductive rights of Latin America women tend to be violated, is my conclusion, especially the right to abortion and essential health care. FIGO and FLASO will continue to advocate and improve the skills of our colleagues to defend their rights. I think that this project shows the capacity of the national societies of OBGYNs not only in the advocacy, additionally in promote activities oriented to change the beliefs in our colleagues and to promote the defense of the women's rights. I'm sure that the success is only guaranteed by teamwork, alliance, and the firm conviction to achieve the objectives. We can achieve it. Thank you very much. It was a pleasure to be with you.
Thank you, Edgar. It was a wonderful talk on the advancing safe abortions in Latin America. It's an important topic for worldwide because access to SRHR services is a big issue. And in a lot of countries, that access, even in a lot of developed countries, that access, due to various other reasons, ethical, social, is not available. Fortunately, in a lot of countries like ours in India, this access is easily available, though there are other aspects wherein the people can't access that because of various other reasons. So, like, logistic reasons and all. But legally and ethically, there's no hurdle at all in many of countries like India. And we should strive at the international level to see that every woman has a right to access these services. So, I'd like to thank you